started. Welcome. My name is Celeste Richie, and I'm the Vice President for Workforce Development at Results for America. I'm really excited to be here today to discuss promising evaluation findings from the WorkAdvance study with Frieda Molina, the Deputy Director for the Low Wage Workers and Communities Policy Area at MDRC, as well as the impressive strides that the state of Pennsylvania is making in building a more evidence-based and equitable public workforce system. And that is with Allison Jones, who's here to talk to us. She's the Deputy Secretary of Policy and Planning in the office of Pennsylvania Governor Tom Wolf. Both of these efforts are actually highlighted in RFA's recent Moneyball for Workforce report, which outlines policy recommendations for the reauthorization of the Workforce Innovation and Opportunity Act, WIOA. So Moneyball for Government broadly is a project at Results for America that encourages governments at all levels to increase their use of evidence and data when investing limited taxpayer dollars. I'd like to start with you, Frieda, and learn a little bit more about the WorkAdvance study. So for folks who have not yet read the findings, could you share what are the key takeaways for policymakers and practitioners from the WorkAdvance study? And what was the WorkAdvance study looking to learn?
So the WorkAdvance study was an evaluation of 4 programs that used a similar model of occupational skills training that were equipping individuals to gain specialized skills that met the labor market needs of employers in their region. So each organization in the study focused on one sector, or in one case, 2 sectors, and they were training individuals for jobs in that sector that had room for advancement and growth, and more specifically, also focusing not just on that first job, but trying to extend the gains, the earnings gains and employment gains into future years. So there was definitely an advancement focus of this evaluation and of the providers that were involved. So we were really trying to understand whether individuals were better off by getting this training and then could advance over time. So in terms of the takeaways, I think not only just looking at this study, WorkAdvance, which is one of now 7 studies that the field has been able to evaluate, 7 programs, I'm sorry, that the field has now evaluated that where they're taking as sectoral programs. I think what we find across them all is that they can be effective at increasing the earnings and employment for adult workers, as well as that they can be a route for economic mobility. But the findings across all these studies, and even within WorkAdvance, are mixed, which suggests that there's still more work that the field can do to continue to improve these programs. So let me just be a little bit more specific. So WorkAdvance being one of the studies of this sort of sector domain, we found that compared to a control group, so individuals came into the program, were selected either to be in the program group or selected to be in a control group. So we're comparing outcomes between individuals in the program compared to what individuals would have done on their own, and that's the control group. And we do find that there are impacts on enrollment in training, impacts on completion of training, and certificate attainment. And that is true not only within WorkAdvance, but it's true across the 7 studies now that we have on sector programs. So while impacts are true for most of the programs in the short term, meaning 2 to 3 years after enrollment in the program, those earnings aren't necessarily true for all of the programs. So I think what this demonstrates for the field, and the takeaway, is that these programs can do better at helping individuals complete training. They can do better in the short term in increasing their earnings, but again, not for all programs. So if we look now beyond those first initial years of placement, we also see some positive, a positive picture, I would say, in some programs in helping people to continue on their path towards upward mobility. So at the moment, there are long-term impacts for 2 studies, WorkAdvance being one of them and Project Quest being the other, where we have evidence beyond 4 years after study enrollment. And for one of the programs in WorkAdvance, Perscolas, which is a program that's focused on training individuals in the information technology sector, with 4 to 8 years of follow-up, we do see that the program increased earnings for a program group, on average about $6,000 compared to the control group. Two other of the providers in the WorkAdvance study, one in Tulsa, Oklahoma, operated by Madison Strategies Group, and another in New York, operated by St. Nick's Alliance. Also, we see that they increase the likelihood of individuals having earnings at least $30,000 a year. And those type of earnings we also see in the Project Quest study, where they see earnings at year 9, so 9 years after study enrollment, program group members were earning on average 18% more than a control group, or around $5,200. So I think what I want to kind of have folks take away from this is that sector focused employment strategies can be effective at increasing employment and earnings. It's not true across all of them. And so I think what the field should take away from this is that there's still more that we can do to continue to strengthen operations. There are some things that I think we know from our research and that of others about some of the characteristics that are important or contribute to success. One is the maturity of the program. So these programs take a lot to implement. We can't just set up a program and assume that very quickly you're going to get the kind of earnings gains that we saw. The staff need to really embed themselves and understand the industry, understand what types of training will help individuals be competitive for the jobs that employers have. They need to understand the type of screening mechanisms that are important to select individuals. And they really just need to have a chance to mature and understand the industry in a deep way, so that they can provide the type of training and pivot if they need to, if demand changes. So maturity is one piece of it. I think access to employment supports is another component that's important for the individuals that are in these programs. They need to have assistance in some cases with transportation or childcare or tools or books, but they also need coaching support to help them make them through the training itself, so that they can complete and they can get placed in a job. Another piece of this, and we found this in WorkAdvance, is it's important to select the right occupation. So sometimes occupations that are selected for these sector programs have very low bar to entry, are very short term, and they may be a good first step in getting that entry-level job, but unless there's additional coaching or additional support to help people move beyond that first job, you're not likely to see them do as well as if you place them, and this is what I would suggest, in looking at higher wage employment occupations within a sector that give them a little bit better than what they would have done on their own. So for instance, a certified nursing assistant, many of these programs in healthcare target the CNA occupational track, with the assumption that people will over time increase, maybe go back to school and become a registered nurse. Oftentimes that doesn't happen. And the wages for CNAs nationally are about $12.75 an hour. Now, similarly, one could instead focus on medical billing and coding, and the average wage for that occupation, which isn't very much additional training than the CNA job, would get you to $18.60 an hour nationally on average. So I would suggest looking at the occupations that you're initially targeting. And also make sure that individuals that come into the program actually complete and get a job in the targeted sector. So impacts are a function of both selecting the right occupation with the wage premium, as well as getting enough people placed in those jobs. And then finally, I would just say the last takeaway is that there needs to be ongoing support for how to advance over time. And I'll talk about that a little later. But I think that this area of economic mobility is one that the field still has a lot to learn, and I think we began to learn some things about that in WorkAdvance, and I think it just takes time to advance over time. Thank you.
Yeah, thanks for sharing that. I mean, I definitely was very excited to see these findings come out. And I know others are, especially given the current economic climate with, you know, what's happening in related to the global pandemic, but also, you know, looking at historic trends around racial equity. How can the WorkAdvance findings be applied to accelerate economic mobility right now?
As I mentioned, that this area of economic mobility is one that we still have some things to learn. I think it's true that you can't just place a person in a job, in a first entry-level job, even if there's room for advancement, and assume that they're going to advance on their own. I think, you know, some will, but a lot will need additional support. So an advancement is hard for a number of reasons. If you think about it, it's not immediate. You place somebody on the job and, you know, they're just getting acclimated and they're excited about the job. And so they're not really thinking about the future and how they're going to advance. The other problem with advancement is that people's plans change, right? You may start in a sector. We know that people don't stay in the same occupation all their life. And so they may start in a sector or an occupation and then, you know, for whatever reasons, decide that's not for them, or that something happens and they decide that they're going to move on. Life gets in the way. So we may have the best intentions of going back, getting additional skills or additional schooling to help us advance, but it takes effort, and when you know, personal circumstances are such that oftentimes we don't take those next steps. And finally, I think it's really hard to know how to achieve advancement. It's not clear how to do it. And so for those reasons, I think we have to be much more proactive to continue to work with the alumni of these programs so that their first job, so that you don't stop working with them after their first job, that you continue to guide their trajectories over time. And in WorkAdvance, what we found is that you have to be proactive from the very beginning, and you have to message the program differently. So it's not, you don't message your program about being a job training program, but you message it about being a career advancement program. And that messaging continues every step of the way along an individual's time in the program, so that when you get to the point where they do get placed in a job, they know that you're going to continue to work with them and you're going to continue to guide them about how to make strategic decisions about what's the next step for them. And I think there's, you know, there's an adage, certainly in the research world, that's apropos here. And I think is you get what you measure. So for me, what that suggests is that funders need to measure and invest in long-term outcomes. So beyond those short 30, 60, 90 days, I think we really need to, if we want to see economic mobility, I think we need to think about considering funding and beyond those 2 years of, you know, beyond 2 years of follow-up. And that means funding for staffing, and that also means focusing on the outcomes that you want to see people achieve long-term. So, so those are some of the things that I think we need to pay attention to when we're thinking about economic mobility.
Thanks. Yeah, I'm so glad that you brought that up. So relating to the Moneyball report that I mentioned before, the first section is on building evidence for what works, which includes a recommendation to set aside 1% of WIOA funding for evaluation, as well as improving state longitudinal data systems to better support evaluations and understanding what works for whom in what context. And I think all the nuance that you just provided, you know, is important to keep in mind as we're designing those evaluations and including communities in those evaluation plans, so that we really are answering questions that that are going to get us closer to understanding how to achieve economic mobility for folks who have not historically been part of that equation. And then the second section focused on investing in what works, including defining and prioritizing evidence of effectiveness when spending WIOA dollars. And so that focus on longer term outcomes that you mentioned, I think is so important. And I really am glad to see more and more states turning in that direction. It's really great to see the WorkAdvance study and the findings, seeing some replication over time to understand what are themes and what are components that might be able to be replicated elsewhere, are all things that give me a lot of hope and inspiration. Another thing that gives me a lot of hope and inspiration is our next guest, Allison Jones from Pennsylvania. And Pennsylvania has recently taken steps to implement some of the recommendations in the Moneyball report, namely defining, what does evidence of effectiveness look like in Pennsylvania workforce systems and in your programs? And can you tell us a little bit more about your initiatives and how you're rolling out these evidence definitions?
Yes, thank you, Celeste. Well, as you noted earlier, we've been making progress, I think, in developing a more evidence-based and data-driven and equitable workforce development system. And so to continue this work in May, the Pennsylvania Workforce Development Board, which is our state workforce development board, took an important step in defining the evidence standards for our workforce development initiatives and that we will use to evaluate them. We started this work last fall in partnership with RFA, learning from some experiences of our peer states that are leaders in evaluation, and socializing this concept of building evidence and what that means with our workforce development partners. Ultimately, we vetted this through the process of the state board and the committees there, and trying to build support with it with our workforce community. And I think ultimately this shared understanding of the levels of evidence will help us ensure that the whole system is moving in the same direction, especially since workforce is primarily a federally funded system, but it's locally driven by our local workforce development boards. Building on this step, we will be surveying soon our local workforce development boards and other partners to get a better sense of their ability to incorporate evidence into their work, and how they might approach building evidence at the local level. We hope that this survey will help inform how the Commonwealth can support our local partners in developing their own capacity for program evaluation and building evidence, but also help us identify areas where the Commonwealth how the Commonwealth can fill the gaps and support that work across the state. The timing of this is particularly important in light of COVID. We have more workforce development customers than ever before, both those that were engaging in the system before COVID, but obviously those that have been impacted by COVID. And so we hope that this work ultimately will help us better allocate workforce development resources, but also ensure that we are investing in programs and strategies that demonstrate effective outcomes for our customers.
That's wonderful. I'm really glad to hear about and be part of the survey work, because I think to really understand how the field is receiving these definitions and how to make sure that this is really an effort to raise the bar across the workforce system in Pennsylvania, not necessarily to exclude anyone. And I think when you examine historic inequities, it's so important to make sure that the process really includes everyone and is helping to empower communities and local areas across Pennsylvania to be part of leveraging evidence and asking questions about the programs that are serving those communities and being empowered to use the data that they have. So I really appreciate that component of it. How do you envision these efforts leveraging evaluation results like the recent WorkAdvance study? So how do you kind of see, as you look down the path towards the future, something like the WorkAdvance study results coming into play in Pennsylvania?
Our first major step was defining evidence and obviously trying to build support within our partners, so we're all working towards that same goal. But I really think our work in this space is just getting started. And as I mentioned, in our effort to build our capacity and expertise, we're also trying to kind of change the culture of what evaluation means, and hopefully sharing with others like the positive impact that evaluation can have on our public initiatives. So when it comes to the WorkAdvance study, I mean, we can learn from the results of the study and apply them to our work now. Particularly some of the points that Frieda brought up related to how we can maximize the long-term gains of workforce development programs, the connection to career pathways, and this idea of like long-term career advancement and lifelong learning. We're doing a lot of work to try to address barriers to employment and make sure that individuals have the supports they need to navigate those life challenges that pop up. And, you know, we've been interested in trying to move away from just case management to a more comprehensive coaching model. And so I think I'm encouraged to know that, you know, those were some successful elements of the programs that were highlighted in the WorkAdvance study. I think long-term, you know, our hope is that we can partner with respected evaluators to pursue rigorous evaluations just like the WorkAdvance study, where we could do a deeper dive in the specific programs that we're investing in PA. You know, by my estimation, the WorkAdvance study would probably be considered one that's demonstrating strong evidence. And so that's the gold standard that we're striving for. We're also working towards, you know, aligning this evidence work into our funding decisions and grant making so that, like I said earlier, you know, we continue to invest in proven strategies that we know will result in positive outcomes for our workforce customers. And in the long term, you know, our ultimate goal is trying to connect folks with high quality education and training opportunities. And I think evaluation is a really important way to make sure that we're doing that well.
Yeah, that makes a lot of sense. And I'm excited to see where this initiative goes in Pennsylvania. I think, you know, you're both leaders in different ways in evaluation and related to workforce. And taking evidence and data seriously as a real tool to help improve the workforce system. So what advice would you both share with federal, state, and local workforce boards looking to leverage evidence like this in their initiatives, or any other final thoughts? And I'll start with you, Allison.
Sure. Well, we have a really large and diverse state when it comes to workforce development. There's a lot of folks engaging in this space. And so we took an intentional, slower and more deliberate process to engage our workforce partners along the way as we, you know, started by defining evidence to make sure that they were bought into the initiative and that they could see the positive value of evidence in the work that we're doing. In many ways, this is systems change. And so we, you know, took this process because we wanted to set the conditions for this initiative to last long term. So I think one piece of advice for those interested in this work is that, you know, you really want to think about why you're doing it and not rush into it, so that it's integrated into your overall workforce goals and strategies. However, all that said, I do feel a sense of urgency to continue this work expeditiously and really operationalize this evidence building because, you know, every day we're investing in workforce development and we want to make sure, like I said earlier, that, you know, we're prioritizing opportunities that will ultimately support Pennsylvania workers and families in the long run.
Thanks so much. And how about you, Frieda? Any advice?
So a couple things I want to just sort of leave folks with. So one of the, you know, sector programs take this dual customer approach, which is what defines them, but it also can limit who participates in these programs. And it's also, you know, one of the areas that's been you know, well criticized about sector programs is that they, you know, screen pretty extensively for the applicants that they enroll. And I worry that in this economic environment where so many individuals have lost their jobs or are unemployed, that those who were struggling even before the economic downturn will be left further behind. So from a really an equity and inclusion lens, I think we need to make sure that we need to make sure to help those who were harder to assist or who needed help even before the pandemic, and not take those who may be easier to place or easier to help. So so really pay attention to how you know, who you serve, and make sure that you don't leave those behind that may take additional effort. And actually our evaluation results actually suggest that the long-term unemployed or the semi-attached, those meaning in WorkAdvance, those that were unemployed either 1 to 6 months before they came into the program or unemployed long-term, were the ones that actually did better in WorkAdvance than those that came in who already had jobs. So again, a plug to really pay attention to who you serve. But also I think it's, to Allison's point, I think we need to invest in a culture of continual improvement. So I think sometimes that practitioners worry about being part of evaluations because they think that this is going to prove maybe that they're not effective. And I think that's the wrong way to look at evaluation. Evaluation really can help, and I think this is also incumbent upon researchers to help those practitioners understand areas where they can continue to improve. So don't think of evaluation as either being a thumbs up or a thumbs down about the effectiveness of a program, but think of it as a way to learn very specifically about areas where you can improve. So, you know, look who comes in and doesn't complete. So what supports do they need? You know, be proactive about following up with individuals so that they can make it through and get the kind of jobs that you're hoping to place them in. So even the best programs in WorkAdvance, you know, we found that 20% of those who enrolled didn't complete training, and about 40% of those who did enroll never got a job in this sector. So there's still room to improve, and I think that this is what I think where the field needs to go, is continue to kind of think about how can we continue to continue to provide the kind of supports and information that will help programs continue to refine and improve and adapt their programs to the new environment.
Yeah, those are all really good points. Appreciate that, and just appreciate both of you for being here today, for being leaders in building a more evidence and outcomes-driven workforce system. And I look forward to continuing to see both of your work move forward. So thank you so much, and I look forward to staying in touch.
Thank you.
Thank you, Celeste.